And then we're going to move to the pulmonic. This is once again basically the apical. Down a little further is the mitral. Over to the right side is the tricuspid, I'm sorry. Okay, she sounds good. We're actually listening for any murmurs or any irregular heart rates. Okay, and the next thing, I'm going to talk to you about breast examination. Do you examine your breasts every month?
No.
Okay, you should examine them monthly, usually around day 4 to 7 of your period.
Who is that?
People. Larger facilities. What you're going to do is palpate each of your breasts in all 4 quadrants, going around hand over.
So like this. Okay.
You're going to make special attention to the outer portion because that's where a lot of tumors are found. You're also going to palpate your nipple, see if there's any discharge. So yeah, you're going to want to do that monthly, day 4 to 7 of your cycle. And can I have you lay down? I'm going to look at your abdomen now.
Should I do that breast examination in the shower?
Oh yeah, do it in the shower. Because that's when the skin is nice and smooth. Okay. So I'm just going to take a look at your abdomen. Can I lift up your shirt? No. Okay, well,
You don't need to go under the clothes.
Participant. Everything looks good from what I can see through your shirt. We're going to auscultate for bowel sounds now, starting in the right lower quadrant. This I am going to go under for, okay?
I don't care.
Okay, she appears to have normal bowel sounds. Okay, now what I'm going to do is lightly percuss in each quadrant. Tell me if you have any pain. Everything feels normal with the percussion. And I'm going to lightly palpate. Have you been having any abdominal pain? Okay. This is just light palpation. Tell me if you feel any pain. And we'll go a little deeper the next time, okay? So with deep palpitation, you'll want to go about 2 to 3 inches. Still no pain? Okay. Now I'm going to look for the liver border, which should be below the right midclavicular line. Actually feels like it's right here. Sorry, is that hurting you? Okay. And next I want to palpate the aorta, which should be right here. No pain there? Either? Okay. Okay, now I'm going to take a look at your legs. Okay?
Oh, okay. Oh, against me, I didn't shave.
That's okay. Okay. I'm just kind of checking. Can I take your shoe off? For real? Okay. We're just checking for edema. You can take your sock off. She doesn't appear to have any edema this time. And I'm going to palpate her pulses, her dorsalis pedis. Okay. Posterior tibial. It's a little bit weaker than your pedal pulse. Her popliteal will be behind the knee here. I don't know if I'll be able to get it. Jeans on. Obviously we'd be in a gown. And our femoral will be up here. Spare you that. Okay, and inguinal lymph nodes would also be right here. I'll do it on myself. In the pubic area. Okay, and while I have you laying down, can you lift this leg the whole way up, well, as far as you can get it. Bend your knee. Okay, and pull back with your. Okay, and do that with the other leg. Okay, can I have you wiggle your toes on this foot? Okay, good. So we're just checking range of motion. Put your shoe back on. Maybe. It's never good with putting shoes on. People always put. Okay, I can have you stand up now, okay? Sorry. Okay. I just have some things to get here. Okay. I'm going to check your neurological status right now. You're alert morning and times 3. You're not weak. The first what we're going to do is a doll and sharp test, okay? What I'm going to do is have you stick your arm out. What is that? Sharp.
Doll.
Okay. Let me do it on the other arm.
Sharp. Doll.
Okay. Okay. I'm going to put 2 different objects in your hand.
Okay.
I just need you to tell me what they are with your eyes closed. I'm sorry.
A pen and a smooth tongue presser.
Okay. Good. Okay, what I want you to do now is touch your nose with your, well, either finger, that's fine. Now touch it with your other finger and alternate a couple times for me. Okay, good. Now I'm going to have you touch your fingers to your thumbs. Good. Yep, that's good. I'm going to have you move your finger between your nose and my finger. Like go, you're going to touch my finger, then touch your nose. Good. One more time. Good. That's good. And next what I'm going to have you do is take your heel and run it like this. Okay, good. Then we're going to have you cross. Good, you didn't fall down. That's good. Okay, what I'm going to have you do next is I'm going to observe your gait. Can you walk approximately to that chair and back? Then I'm going to have you do heel to toe, kind of like you're being a DUI. Like this. Okay. Okay, now I'm going to have you stand with your feet together, your hands at your sides. Close your eyes. You should be able to stand there for about 20 seconds without swaying. Okay, good. Now what I want you to do, stick your palms out like this. Same thing, close your eyes. Okay, good. Okay, now I'm going to check your hand grip. Okay. Squeeze. Okay, equal. Okay, and can I have you sit down? Ain't too good. Okay, what I'm going to do is check your patellar reflex. First you locate the towel on here. Okay. Okay, just going to tap. You should reflex. I'm going to keep my hand up here. Do it one more time. Okay, good. Okay, and lastly, what we're going to do is, I'm just going to look at your spine again. Can you stand up for me? Okay, I already palpated her spine, and everything looked good, but what I need you to do is bend down and try to touch your toes. You don't have to touch them completely. But we're just making sure that everything looks straight. It does. You were never diagnosed with scoliosis.
No.
Correct? Okay. Everything looks good there. You seem to stand up straight, so you're good. Do you have any questions?
Good. Thank you.
Okay, thank you for being a great patient.
Thanks for being a great nurse.
Okay.